Hello, I'm Dr. Warren. We're going to record this video in a little bit different format, but what I want to do today is help walk through what happens to you as a patient when you're going to the doctor and how you're kind of slipping through the cracks. There's some updates on the CDC website, and I'm going to basically just be going through some of the CDC website and what should be happening versus what really does happen kind of in practicality. Just trying to help illustrate what happened to me, what happened to my family, and what I hear happens to patients when you're going into the doctor around getting diagnosed with Lyme, figuring out what's causing your symptoms. So let's just dive in, figure out why you're becoming a mystery, and if we can't help, solve it. So if you just go to Google, type in CDC Lyme, you'll pull up the CDC's website. So I'm going to do this in a screen share format here. So we come to this page, and I'm just going to highlight on this page the differences between what the CDC says should be done and what actually happens in your doctor's office. So I do not think that everything on this website is perfect, but what I want to stress here is most patients that we hear their story, they're not even getting close to the published standard of care. That's sad, particularly in Lyme endemic areas like we are in Minnesota and Wisconsin, the number 4 and 5 states for tick-borne illness. So this is a huge, huge issue. So I'm just going to highlight here when people go into the doctor. Lyme disease, most common vector-borne disease in the United States. If it's the most common, your doctor should know a lot about it. Lyme disease is caused by bacteria Borrelia burgdorferi and rarely Borrelia mayoni. I want to stress here that there's other bacteria. They do talk about them. I'm not going to go into this. There's other tick-borne illnesses that aren't Lyme that these ticks carry that should be tested as well. But already I have kind of a little bit of a beef with what happens. Lyme disease is caused by Borrelia burgdorferi. This is the Lyme test that most people run. No one runs Borrelia mayoni. Not even the Mayo Clinic, who discovered it. It's called Mayoni. It's discovered in Mayo 2013. And one reason people fall through the cracks is they're only testing the one species we discovered in 1982. They're not running multiple Lyme species, including Borrelia mayoni, especially in Minnesota and the Midwest where it really was discovered. But there's multiple species. That's one way people fall through the cracks. It's transmitted through black-leg ticks. Yep. Typical symptoms include, now this is important, typical symptoms include fever, headache, fatigue, characteristic rash called erythema migrans, so a rash. Now, notice it does not say the only symptom you have is a rash. It does not say the only symptom we care about is a rash. It says there's fever, headache, fatigue, and a skin rash. It also says if left untreated, an infection can spread to joints, heart, and nervous system. What we want to highlight here is Lyme can actually cause a variety of symptoms. It can cause nervous system symptoms, heart symptoms, joint symptoms. It can cause headache, fatigue, and rash. Now, the trouble we have with this is when you go to the doctor, what it happens practically is if you have the rash, we think of Lyme disease. At least 50% of patients don't have a rash. If you don't have a rash, what happens is we miss you. The current medical system does not think of Lyme disease when you come in with heart symptoms, joint symptoms, nervous system problems. You go into the doctor, we get sent to a cardiologist, we get sent to a neurologist, we get sent to a rheumatologist. They'll check things, but not usually Lyme disease. So this is a huge problem is if you walk in with the rash, we find Lyme. If you walk in with a myriad of other symptoms, and we could go through other parts of this website showing that 13 to 17% of people who have Lyme get neurological complaints. The only people we catch are the 3% of people who get meningitis. It's so bad you end up in the hospital and we end up doing spinal taps. So 14% of people with neurological problems are missed. Once again, I think this is a huge miss right now with the current medical system. Not theoretically, but what practically happens. If you walk in with these kind of symptoms, you get bounced through the system. It can take months and no one figures out this is really coming from Lyme. Lyme disease is diagnosed based on symptoms, physical findings, example, a rash, or other symptoms, not just the rash. I want to highlight this. Yes, the rash is the one thing we're good at finding, but if you have the other symptoms, it's important. So Lyme disease diagnosed based on symptoms, physical findings, and possible exposure of infected ticks. Laboratory testing is helpful. Now, here's what it doesn't say. It doesn't say we ignore your exposure to ticks, we ignore your symptoms, and we go 100% based on the test. This is what happens a lot. When I have patients who come in, we'll listen to symptoms, don't care if you've been exposed. All we care about, we're going to do 100% of our treatment based on the test. This is also a mistake. The CDC is not recommending this. Nowhere is it recommended to ignore symptoms, ignore exposure, and only go 100% based on the test and do nothing if the test doesn't show it. Nowhere is that the written strategy. Yet practically, this is a huge obstacle that we end up fighting against, is the doctor will say, well, you have all the symptoms and you've been exposed to a tick, but your test was negative, so I'm doing nothing. That's not what's recommended. The testing is supposed to be part of the picture, not the entire picture. Now, I have other videos where we walk through some of the testing, but we've already talked through brief highlights. You really should be checking Lyme. You really should be checking multiple species of Lyme. You really should be checking co-infections along with the Lyme. And the criteria the CDC set up is extremely stringent, was not meant to be used in a one-on-one doctor basis. So it's not the end all be all. It's one piece of the information you are to use when making a diagnosis as a doctor. So if someone comes in with these kinds of symptoms, you need to be aware that a certain amount of people who are going on referral to neurology, the problems are coming from Lyme. A certain amount of people who are being referred to rheumatology for the joint pain, a certain amount of that's coming from Lyme. A certain amount of people who are going to the ER or being sent to a cardiologist, that is coming from Lyme. And what I do not see right now happening is I do not see a patient who got sent to neurology being figured out that it's Lyme, or a patient who's into the ER or cardiology figuring out that it's Lyme, or a patient who has joint pain figuring out that it's Lyme. What happens is we go to that doctor, they rule out rheumatoid arthritis, they rule out a heart defect, they rule out MS, and then they say, I can't find anything, maybe it's anxiety, and they offer someone just pills for their symptoms. And this is unfortunately what we see happening all too often. If your doctor is going 100% based off that standard test, which is from the 90s, it's just old and outdated and dramatically needs to be updated, that's not what he should be doing by anyone's published standards. They should be taking into account what's your exposure. Do you live in Minnesota, Wisconsin? Are you outside? Do you camp? Do you have some known exposures? What's the reasonableness of you being exposed? Do you have symptoms? Joint pain, fatigue, headaches, neurological problems, heart symptoms that are otherwise unexplained. When you have these kinds of unexplained symptoms, particularly if they're acute onset or they've been going on for a long, long time, then Lyme becomes higher on the possibility of what's driving your problem. Now, as a quick tease, we're going to end that video here on what is happening with the diagnosis process, but there is a note now, there's a section on post-treatment Lyme disease syndrome. The CDC changed their stance after 40 years and saying, no, you can't have long-term symptoms from Lyme. There's no such thing as chronic Lyme. We don't believe in chronic Lyme, which is also a frequent thing doctors say. To now we have a whole section on it and we know it's real. In another video I will highlight the post-treatment Lyme disease tab here under the CDC, what we're really excited about, what we're a little disappointed in, and just trying to come at it from a patient's point of view. To finalize this one, what we tried to highlight was what is recommended as far as diagnosing Lyme is not what really gets done. And unfortunately, that means you as the patient get sent through the cracks. People miss the diagnosis. You get diagnosed with something based on symptoms or put in some category that doesn't really quite fit. And therefore, the treatment doesn't really work because no one's figured out the root cause. In order to look at Lyme, you want to look at your risk exposure, any kind of symptoms, not just the rash. You can have Lyme without the rash, and you're specifically looking for symptoms in nerves, pain, fatigue, headaches, heart. These kind of things make us more and more suspicious that Lyme may be causing it in your case. I hope you learned something today. I'm Dr. Warren. Thanks for learning with me.